Although I cannot see you directly, that does not stop me from welcoming you all. I extend a very warm welcome to my student fraternity, a very warm welcome to the home science fraternity, a very respectful welcome to the retired staff, a very cordial welcome to fellow Queen Marians, and a very, very warm and cherished welcome to all participants of this show. It is understood that improving immunity is fundamental and good nutrition supports good immunity. The immune system is the body's defense against disease and infection. Like any other fighting force, it is known that the immune cells of the body marches on its stomach. In other words, a good immune system requires regular and good nutrition. Scientists have long recognized the relationship between immunity and nutrition. They have found out that malnourished individuals are more vulnerable to infectious diseases. Today, the focus is on the role of micronutrients in affecting the immune system. Animal studies have shown that micronutrients alter immune responses. Systematic and clinical trials have shown that deficiencies in the micronutrients can impair one's immune system. Collectively, micronutrients such as vitamin A, B6, B12, folate, vitamin C, vitamin D, vitamin E, and minerals such as iron, zinc, selenium, and copper all together work to boost the immune system. So it is therefore widely understood that having a diet that is nutritious and contains both vitamins and minerals is necessary for an optimal immune response. This is because these micronutrients are not only essential, but they also synergistically act at every phase of the immune response. They are capable of removing the free radicals by behaving as antioxidants. They also assist in T cell production. Now, this gains a lot of prominence today because we are trying to fight against the viral infection that is caused by COVID-19. So, in this scenario today, to throw more light on these aspects and to give us take home messages, we have with us the very capable and proficient resource person, Dr. Deepta Sugmar. To say a few words about Dr. Deepta Sugmar, Dr. Deepta Sugmar holds a PhD degree in nutritional sciences from the Drexel University, Philadelphia, United States. She has acquired her post-graduation from Queen Mary's College, which I'm proud to say, and she has also acquired her undergraduate degree from MOP College, Vaishnav. And to what is special about Dr. Deepta is that she has been an outstanding student both at the undergraduate level as well as at the postgraduate level, and she has bagged the best outstanding student in both these institutions where she studied. Needless to say that Dr. Deepta has given about more than 50 international publications, and this includes publications in peer-reviewed journals, in conference proceedings, and in invited presentations. And she has also contributed to chapters in several books. She is a well-known peer review. Sorry, extremely sorry. She is a well-known reviewer in peer-reviewed journals, some of which are Journal of Nutrition, European Journal of Clinical Nutrition, Nutrition and Sports Medicine, and so on and so forth. So she's a very accomplished academician, and I would be failing in my duty if I do not mention the honors and awards that Dr. Deepta has won. She has won the Mentor and Mentee Award, American Heart Association 2016. She has won the Research Excellence Award, American Heart Association 2016. She has won the ASBMR Young Investigator Award, conferred to her by the American Society of Bone and Mineral Research Topical Meeting both in 2010 as well as 2011. She has won the Energy and Metabolism Research Interest Section Award, which was given to her by American Society for Nutrition both in 2009 as well as 2010. Apart from this, Dr. Deepta is dealing with a lot of research on bone health. The other areas of research in which she has invested her interest is in obesity and the role of vitamin D, magnesium, and even metabolic syndrome. Actually, her profile runs to 19 pages, so I've just picked on the highlights and mentioned it to you for want of time. Now, before I invite Dr. Deepta to make her presentation, I would like to make a few announcements to the participants. Participants may post their questions in the comment box while the session is going on. You need not wait for the end of the session to post your questions, because we may miss out on the questions that are posted at the end as we have to shift scenes. Another announcement is that the link for the feedback form will be pasted on the comment box regularly during the session. You may log into the link and submit your feedback form in order to get your e-certificate. Thank you. And now I request Dr. Deepta to make her presentation.
Kalai ma'am and Reggie ma'am, thank you very much for this opportunity. I hope you can hear me okay. Let me know if you cannot. And thank you to everyone who's joined here today. I see a wide range of people joining from all over India, and it's a pleasure to talk to all of you. I do want to specially mention a few of my professors, including Reggie ma'am and Kalai ma'am, who taught me, and some of the other former professors who've joined us today. I do see Chandra ma'am and I see Ranjana ma'am join us as well. So thank you to all of you who have joined me today. Gives me immense pleasure to talk back to my alma mater and talk to you all on the role of nutrition and immunity. Although the role of nutrition and immunity is not one of my research focus, my research focus lies a lot on vitamin D and micronutrients. And as Kalai ma'am had mentioned, I can speak or I can understand literature and interpret literature on the role of micronutrients in immunity. And that is what I wanted to present to you today. So what we will be speaking about today is an overview of the immune system. Let's talk about what can depress our immune system, the various factors which play a role in influencing our immune system. Most importantly, we're going to talk about how nutrition plays a role in immune function. We will then talk about the highlight for the day, which is COVID-19, and how that influences your immune health. We will then speak a little bit about the research evidence on nutrition and COVID-19 outcomes. And finally, a few key takeaways. What is it that I want to tell you in terms of research findings between nutrition and COVID-19 outcomes? So as all of us know, there are two important types of immunity. You have your innate immunity, which is a fast, non-antigen specific type of immunity. And you have the adaptive immunity, which is slow and antigen specific. And what this really means is your innate immune system is your physical barriers, such as your skin, your respiratory tract, pretty much just the physical presence of these organs provides you a protection, or it provides you immunity. You also have your defense mechanisms, you have your saliva, you have your secretions, you have your generalized immune responses such as inflammation. All of these contribute to innate immunity. The problem, however, with innate immunity is that it's non-specific. And when I say non-specific, what this means is that this will defend against anything which the body will identify as non-self. So this is not a very specific type of immunity. What is a specific type of immunity is what we call as the adaptive immunity. And the adaptive immunity utilizes your B cells, your T cells, And the adaptive immunity is highly specific. So this will identify pathogens, and this will also ensure that antibodies are secreted for specific viruses, specific bacteria, depending on the differences in their molecular structures. So when we eventually find a vaccine for COVID-19, what will be activated is your adaptive immunity. Similarly, if you've had a viral infection already, what has been activated in your body is adaptive immunity. So this is the key difference between innate and adaptive types of immunity. Most importantly, let's speak about what can depress your immune system. So a few factors that can depress your immune system, unfortunately, is aging. So as people get older, their important immune cells producing organs such as thymus and bone marrow start producing lesser amounts of these cells. Remember that older age is also associated with micronutrient deficiencies. There is a marked deficiency of B12, vitamin D, other micronutrients that you see with older age because of either poor absorption or poor intakes, all of which can contribute to depressing our immune system. We are also dealing with a lot of environmental toxins these days. So there is smoke, there's air pollutants, of course, excessive alcohol intake. All of these factors can also suppress our immune function. Another main problem with our excess body weight and immunity is that excess body weight is associated with what we call as a low-grade chronic inflammation. So our fat tissue produces a certain type of cytokine called as the adipocytokines, which can further promote the inflammatory process. And in fact, people who are overweight or obese have an independent risk for developing influenza virus, which is one of the other types of respiratory virus that can influence your respiratory system. Most importantly, what is of interest to our group here today is poor diet. So we have a lot of research, as Kalai ma'am had mentioned, on how malnutrition and poor micronutrient status can influence immune function. So if you see children who are malnourished, older adults who are malnourished, they're all at a higher risk for developing, or they're all at a higher risk for a compromised immune function. Finally, lack of sleep and rest. Remember that sleep is the time when your body restores. There are certain specific types of cytokines that are released during sleep. So when you get too little sleep, when you don't get a good quality sleep, all of these can also lower the amount of these good cytokines that are released. People who suffer from chronic diseases, certain autoimmune disease and immune deficiency disorders are also at a higher risk. And finally, although this is one factor we don't really pay a lot of attention to, chronic mental stress. Chronic mental stress can release the stress hormone known as cortisol, and cortisol suppresses inflammation. We all need some level of inflammation, which is needed to activate your immune cells. And when you have excessive production of cortisol due to high mental stress, this can suppress the inflammatory process. So these are all some of the important factors that can depress our immune system. So if you look at this graph, and for all of these pictures that you would see, at the bottom, I'll show you where this has been taken from. So if you have an interest, you can always go back to this original article to look at the information. So of course, a poor diet resulting from low income due to fast food intake, due to being sedentary, due to a restricted type of diet, and all can contribute to a suboptimal nutritional status. And several factors such as pollution, stress, sleep disturbances, excessive alcohol, excessive exercise can all also contribute to a compromised immune function. And all of these together will increase your risk for infection. So how does nutrition support immunity? So nutrition supports immunity through a variety of processes. So remember that when you have an activated immune system, when you have an infection, your body needs more energy, your body needs more protein. So of course, the diet that you consume has to be meeting energy and protein demands of an activated immune system. Certain nutrients have an antioxidant effect. Remember that high inflammation is one of the key factors that's associated with an infection. So when you have these antioxidant nutrients present, they can lower the inflammatory process. Of course, they can lower chronic inflammation as well. In addition, nutrients support both innate immunity and adaptive immunity. So remember, in the first few slides, we spoke about what is innate immunity and what is adaptive immunity. So innate immunity is, nutrients that can support the physical barriers, the nutrients which can support the epithelial cell function, for example, vitamin A. And adaptive immunity are the nutrients which can support B cell function, T cell function, or pretty much several micronutrients have this role. So nutrition supports immunity through all of these different mechanisms. So this is a very busy slide, but what I want you to take away from the slide, and if you have an interest, please go back to this article. What I want you to take up from the slide is that vitamin C, vitamin D, vitamin A, E, vitamin B6, pyridoxine, all of these micronutrients seem to have an effect on both innate immunity and on adaptive immunity. Similarly, B12, B9, zinc, iron, copper, and selenium are other micronutrients which also seem to have an influence on both innate immunity and adaptive immunity. Which aspect of innate immunity does it influence? Which aspect of adaptive immunity it can influence? You can go into this paper to look it up, but that's not the focus of this presentation, so I'm going to move on. And what we saw so far was we saw what are the types of immunity. We spoke about what can depress our immunity. We then spoke about how nutrition plays a role in immunity. I told you there are 5 different ways by which nutrition plays a role in immunity. And then I briefly told you which nutrients could play a role in immunity. Of course, energy, protein, and all of the micronutrients that we just spoke about. But this is something we all already know. This is just a quick recap. We all already know that nutrients play an important role, how nutrition plays a role in immunity. What is really important and interesting for us to know is, do these nutrients play a role in COVID-19? So before I get into this aspect of the talk, a quick recap on what COVID-19 is. Of course, you've heard this from the news, you hear it from different magazines, but let's just see what the statistics are, quickly review what are some of the symptoms of COVID-19. So in late 2019, there was a novel coronavirus that began circulating around the world, and it's called novel primarily because this virus was never seen before. This virus was very similar to the SARS-CoV-2 virus, and it was subsequently termed the COVID-19 or COVID-2019. And it's a beta coronavirus, and it's thought to have originated in bats. Of course, we don't really have a confirmatory evidence yet. What's important to know about COVID-19 is, as of the 13th June 2020, there's been 7 million people around the world who are affected by COVID-19, and close to 500,000 deaths that are reported to the WHO. The real numbers are probably much higher, close to 500,000 deaths that are reported to the WHO. We all know what are the symptoms of COVID-19. Of course, fever, cough, and shortness of breath are some of the key symptoms. There are newer symptoms that are getting added on, but these are the 3 key symptoms. In more severe cases, we see that there is hypoxemia, there is a need for mechanical ventilation. And the problem with COVID-19 is that it can mediate something called a cytokine storm. So a cytokine storm is where your body is just suddenly flooded with too many cytokines and it doesn't know what to do. And that is what really causes the acute respiratory distress. The interesting factor about COVID-19 is 25 to 50%, about half the people who are infected with COVID-19 may be asymptomatic. And these are the people who might actually spread the infection much easier. There are several symptoms that go along with the different types of COVID-19. So for, of course, the ones who are asymptomatic, they have a COVID nucleic acid test that's positive. However, they don't have any clinical symptoms. Their chest image is normal. The ones who have a mild symptom, they have some symptoms of upper respiratory distress. They have some digestive symptoms. The ones who have a moderate COVID seem to have some pneumonia, but of course, they don't really have an obvious hypoxemia. The ones who are severe and critical are the ones who have pneumonia, chest infection, and they have marked hypoxemia. So if you remember innate and adaptive immunity, when the COVID-19 virus influences our system, what really happens initially is there is a primary inflammatory process. And during this inflammatory process, you don't really see a lot of clinical symptoms. When you see a lot of clinical symptoms is during the secondary inflammatory process where there is the cytokine storm, which eventually leads to, as I said, the hypoxemia and the need for mechanical ventilation. So who is at risk for COVID-19 mortality? Of course, the older population is at risk, and those with pre-existing conditions have a really high risk for COVID-19. So the ones who have cardiovascular disease have about a 10% case fatality rate. Those with diabetes, chronic respiratory disease, those with hypertension, certain types of cancer, all of these people are at a high risk for dying from COVID-19. What is the impact of COVID-19? I don't think there is a single industry that COVID-19 has not influenced. Pretty much education, which all of us are a part of, finance, hospitality, real estate, sports, agriculture. So, of course, there are the short-term consequences, which we are all facing right now, and there would be some long-term consequences, which we have to keep an eye out for. So again, we spoke about who's at risk, and when we see who's at risk, the population that I already spoke to you about, in addition, those with liver disease, those in nursing homes, those who have severe obesity are also at risk for developing COVID-19. So the million-dollar question, does nutrition influence COVID-19 risk and outcomes? So this is, of course, the topic of today. And what I want to discuss with you are research findings. So the problem is research evidence is very weak. Remember, COVID-19 started happening around 2019, the late 2019. And whenever we speak about evidence-based research, it's always supplementation studies or possibly some epidemiological findings. And we're only about 6 months into this pandemic, so we really don't know too much about nutrition and the evidence for COVID-19. Remember that this presentation talks to you about research findings. And we do see a lot of case study approaches. So there are smaller groups that say, okay, I've supplemented my group with a high dose of vitamin C. I've supplemented my patients with high doses of vitamin D. I've supplemented my small patient population with ginger, and they're all showing really good effects. But remember, that is a case study approach. Okay, that's not a large peer-reviewed finding. So you have to be very cognizant about the case study approach. Be cognizant about small group treatment protocols that are non-peer reviewed. There is one Chinese article that was really getting popular in Chinese magazines where they showed that 10,000 to 20,000 milligrams of IV vitamin C was effective in 50 patients. This was non-peer reviewed. It never appeared in any journal. Although animal studies, cell culture studies are important, animals are not humans. Cell cultures are not humans. So we need to find these similar findings in a human population. And finally, of course, we all endorse home remedies. These are really important. However, unless and until they appear in a peer-reviewed journal, you cannot generalize these findings. So the purpose of my presentation today is to show you research evidence. And I do acknowledge all of these. There are, of course, small reports talking about garlic, ginger, spices, elderberry. So all of these are, of course, there, but that's not the focus of what I am speaking today. And I don't want to take away from any of these things because, of course, in a small group setting, these might be effective. However, we are a group of scientists and we have to only believe evidence-based information. So does nutrition influence COVID-19 risk and outcomes? So the first takeaway is that we have very limited data. We do not have any supplemental studies in patients with COVID-19. However, the sales of dietary supplements have increased significantly. People actually go to the store, they buy these mega doses of vitamin C, people buy mega doses of vitamin D, they buy ginger supplements, they buy turmeric supplements. So the sales of these dietary supplements have significantly increased. However, we don't really have a lot of data. However, what I could talk to you today about is some of these conditions like acute respiratory distress syndromes, other viral infections, flu, in which nutrition may play a role. And then we can extrapolate some of these findings to possibly COVID-19. Because remember, COVID-19 is also a viral infection. COVID-19 also has symptoms like the flu. And of course, COVID-19 is also associated with ARDS. So for all of these reasons, let's see what are the evidence of nutrients with some of these, and then extrapolate that to COVID-19. So nutrients and dietary supplements, where is the evidence and what should we recommend? So the first nutrient we'll speak a little bit about is vitamin C. So vitamin C has several functions. It decreases the pro-inflammatory cytokines. It can improve antibody production. It can improve WBC migration. It can support your epithelial barrier function. It can scavenge oxygen-free radicals. So all of these are the most important functions of vitamin C and how that could influence your immunity. So the interesting aspect about vitamin C is that people who are deficient in vitamin C are susceptible to pneumonia. And several meta-analyses showed that there is an evidence for reduction in the risk of pneumonia with vitamin C supplementation. But the key takeaway here, again, the key takeaway here is that this was true only in individuals with low dietary intakes. In other words, if you're not taking enough vitamin C in your diet, if you don't have enough micronutrients in your diet, then you would be at a higher risk for developing pneumonia. So there was this big randomized clinical control trial that just came up in JAMA in 2020, which pretty much tested the efficacy of high doses of vitamin C on several outcomes. So this is called the Citrus Alley trial. And the Citrus Alley trial showed that when you give IV vitamin C every 6 hours, 50 milligrams per kg every 6 hours for 96 hours, it did not significantly alter any disease severity score. It did decrease your C-reactive protein levels and some other inflammatory protein levels compared to placebo. And it decreased your all-cause mortality and also decreased your ICU-free days. So there was some evidence for the role of vitamin C on not necessarily improving respiratory function, but overall in reducing inflammation and also reducing mortality. So what are the key takeaways? If somebody comes and asks you, should I take vitamin C for COVID-19? There's no evidence to show vitamin C's status is affected in COVID-19. There are large vitamin C trials in patients with sepsis or ARDS that showed some promise. There are several ongoing clinical trials on the use of high-dose vitamin C and IV vitamin C in COVID patients. And remember that you should not go to a pharmaceutical store and buy too much vitamin C. Anything about 2 grams per day should be avoided because it can lead to toxicity. There are some research findings that recommends about 200 milligrams of vitamin C. So remember, the RDA for vitamin C for Americans is between 75 to 90 milligrams per day. For Indians, I believe it's somewhere between 40 and 60. So there's a recommendation that you can go up to 200 milligrams of vitamin C for healthy individuals. How do you get 200 milligrams of vitamin C? Of course, a small guava fruit, a cup of orange juice, 2 oranges, a couple of mangoes. Indian gooseberry, of course, has a really high content of vitamin C. And things like sprouts, lemons, and fresh fruits can easily give you vitamin C. So you don't have to go and pop yourself a vitamin C supplement. The next vitamin that is very close to my heart, and this is a vitamin that I have been studying in my laboratory for about 15 years now, is vitamin D. So vitamin D is one of these nutrients which showed promise for the influenza epidemic. So the influenza epidemic rate seemed to be much lower during peak sun exposure. And this is one of the reasons it was believed that vitamin D may have an effect against some of these respiratory conditions. And if you look at this graph, the ones where you see a darker gray is where you have a high COVID-19 prevalence. And this was in, I believe, as of March 2020, and things have changed since then. But the reason they even started talking about vitamin D and COVID was because the places which had a high COVID prevalence were also places which had vitamin D deficiency. So these are the places which seem to be exhibiting a lot of vitamin D deficiency. And these are the places which also seem to have a high COVID prevalence. So of course, this graph is slightly different today, as I said, because this is from March 2020. So what this graph shows you is that as your vitamin D levels go up, your COVID-19 instance goes down. And this is also true with mortality. As people's vitamin D levels go up, their COVID-19 mortality is lower. So if you look at the regions that are highly affected by COVID-19, they have a marked vitamin D deficiency. So of course, the next question is, if we improve vitamin D status, does COVID-19 go away? Well, clinical trials are underway and vitamin D made the news. Vitamin D and COVID-19 was one of the top hits in Google a few weeks ago. And this is one of the nutrients which is also studied much more seriously with respect to COVID-19 outcomes. So vitamin D is in the news. It continues to be in the news to see if vitamin D could prevent COVID-19. So what are the mechanisms by which vitamin D can prevent COVID-19? So vitamin D may induce certain antiviral factors. It can reduce the concentrations of pro-inflammatory cytokines. It can increase the concentration of the anti-inflammatory cytokine. So all of these are ways by which vitamin D may influence COVID-19 outcomes. Vitamin D supplementation has also shown to reduce the risk of influenza and other viral infections. So not COVID-19, but there is evidence to show that vitamin D supplementation can reduce the risk for influenza and possibly COVID-19 infections and deaths. So there's been a lot of these clinical trials to show that vitamin D can basically reduce the concentration of pro-inflammatory cytokines. It can reduce CRP. It can reduce the risk of sepsis. And deficiency, of course, does contribute to ARDS. The key finding with respect to vitamin D was that vitamin D concentrations are lower in patients with COVID-19. So if you look at this graph, these two graphs are showing you people who are PCR negative for COVID, and these 27 people are PCR positive for COVID. So as you see from this graph, the ones who are COVID positive seem to have a marked vitamin D deficiency. So their vitamin D levels are pretty much below the 20 nanogram per mil mark. And this is true, and it's even lower in those who are over the age of 70. So if they are over the age of 70, their vitamin D concentrations are much lower if they are COVID positive. So this study showed that there was a significantly lower mean 25-hydroxy vitamin D level in PCR positive patients. Another study from Epa et al. Also showed that people who were critical, so remember in one of the first few slides, we spoke about what does mild mean, what's ordinary, what's severe, what's critical. So critical are the ones who need mechanical ventilation. And these are the people, and if you look at these numbers, I'm just wanting you to look at the serum 25-hydroxy D vitamin D levels. And if you look at these numbers, the ones who have a mild COVID have a vitamin D level of about 31. The ones who have critical or who are critically sick with COVID have a vitamin D level of about 17. So there is a marked vitamin D deficiency in those who are COVID positive. So what are the key takeaways from vitamin D? So what the key takeaway is that a level which is less than 20 nanogram per mil for vitamin D will put you at risk for developing COVID-19. So if you get a vitamin D level test and you see that your level is below 20 nanograms per mil, you want to be supplemented with vitamin D. I know there will be questions about sun exposure and vitamin D, and maybe I can take that as one of the questions, but the bottom line is, with respect to vitamin D, supplementation is better. So go ahead and supplement yourself with vitamin D3, which is a better form of vitamin D. What we don't know is how much vitamin D we should be taking to avoid COVID-19. How does it interact with factors such as obesity, diabetes, and how does it interact with other micronutrients or things we don't know? What we know is that you want to get your vitamin D level above 20 nanograms per mil. So I think I spoke about that. What are some of the other dietary supplements that we can quickly talk about? So there is data from animal studies, cell culture studies to show that fresh but not dried ginger is effective against respiratory infections. And this is especially important before viral attachment. So including fresh ginger every day as a part of your dietary routine may be important. Taking in EPA and DHA, your essential fatty acids, might be extremely important. So an intake of about 250 milligrams of EPA and DHA is recommended. There is research evidence to show that pre and probiotics have a limited effect in influencing immunity, not necessarily COVID outcomes, but in influencing immune health. The problem, as I said, with COVID-19 data is that we are waiting for the results. We don't have a lot of clinical trials that are underway, so we are still waiting for the results. But let me show you some of the most important studies that are underway. So there is a huge study called the COVID A to Z study, and this is using vitamin C and zinc supplementation to see if that may improve COVID-19 outcomes. There are a lot of trials that are looking at vitamin D testing and treatment for COVID-19 because of the evidence that vitamin D deficiency may aggravate COVID-19 outcomes. There are studies looking at the relationship between zinc, vitamin D, and B12 in COVID-19 pregnant women. There is the LEAD trial. The LEAD trial is looking at aspirin and vitamin D together to see if that would reduce hospitalization. But all of these studies are underway and we are waiting for the results. So to go out and say that zinc may have an influence, B12 may have an influence is not confirmatory because we don't have the results yet. So what should we conclude as nutritionists? As dietitians, what should you go out and tell your patients? The first thing you want to tell your patients is that you should not rely on dietary supplements to prevent or cure COVID-19. The current dietary guidelines for treatment of COVID-19 do not recommend dietary supplements. So don't go and tell your patients, don't go and tell your clients to take vitamin C supplement. Don't tell them to take a vitamin D supplement unless and until they are really deficient. However, it's really important to correct malnutrition. So if they have a malnourished if they have a malnourished micronutrient status, if they have a protein deficiency, it's important to correct it. It's important to correct low vitamin D levels. It's important to correct low vitamin C levels. It's really important for them to follow a balanced diet and meet the RDAs for macro and micronutrients. So the micronutrients we already spoke about, the ones that are important. With respect to macronutrients, of course, meeting energy intake, meeting protein intake, meeting the intakes for essential fatty acids might be really important. The last key takeaway is that the best method to prevent the spread of COVID-19 is to avoid being exposed. And social distancing, following hygienic practices are still the best way to prevent COVID-19. So maintain social distancing, avoid touching eyes, nose, and mouth, washing your hands frequently, practicing respiratory hygiene, and if you have a symptom, to seek medical care still is the most important way by which you can protect yourself against coronavirus. So I'll just finish up with this slide where I want to stress about some of the lifestyle factors which may play a role in COVID-19. So of course, balanced diet and hydration. So we're not speaking about supplements. We're talking about a diet which meets pretty much your food pyramid. So consume adequately your grains, your fruits and vegetables, moderation in meat intake, and eat your fats and oils sparingly. Make sure you get enough exercise. So the American Society of Sports Medicine recommends that you get at least 150 minutes of physical activity every single week. So ensure that you are exercising. Of course, aerobic exercise will increase your lung capacity, will improve your respiratory health. So make sure exercise is practiced. And another aspect with exercise is when you're in the lockdown situation, you really do want to make sure that your muscles don't get atrophied. So do practice some level of strength training at home itself. You want to focus a lot on stress management, because remember that stress can contribute to an adverse immune outcome. And finally, sleep is just extremely important. Good quality sleep will ensure that the right type of cytokines are released, which can then help you fight infections. So, a combination of all of these lifestyle factors will ensure that even if you're infected with COVID, you come out of it effectively. And unfortunately, supplements and nutrition supplements do not find a place in this box at the present moment. However, things may change in a few months, and maybe I can come back to you and present to you what are some of the findings in these large supplemental trials at that point. But at this point, to your patients, to your students, to your clients, stress the importance of balanced diet, stress the importance of exercise, the importance of stress management and sleep. With respect to diet, the two things that are really important is correction of vitamin D status with COVID-19, and a correction of vitamin C status with respect to COVID-19. And with that, I will end my presentation, and I will be happy to take any questions that you might have. Thank you. Be happy to take any questions that you have.
Thank you, Deepta, for this insightful presentation that you have made. A large number of questions are just coming in. There's one question which asked about what is the duration of taking good nutrition? Is it only during the risk phase?
Of course not, right? So this is something that good nutrition begins pretty much in utero. So it's just not during the infection. So it pretty much begins in utero. A lot of the framework for later autoimmune diseases, for the development of later chronic diseases, begins as a child. So good nutrition is important pretty much throughout the life cycle and just not during the infection phase.
There's another question about zinc supplementation. Because hypogeusia and hypoosmia are also added to the existing symptoms of COVID-19, can zinc supplement be recommended as a preventive measure?
So none of these supplements can be recommended as a preventive measure. However, it's important to ensure optimal zinc status. So it's important to meet your RDA for zinc, but at this point, we don't have evidence to show that zinc supplements can prevent COVID-19. Hypothetically, yes, because of course, zinc plays an important in the development of these altered symptoms. Hypothetically, yes. However, we don't have evidence. It's important to meet your zinc recommendations. That's the takeaway here. So if you're zinc deficient, maybe your chances for developing COVID-19 might be higher. So ensure that you meet your RDA for zinc.
There are two questions with regard to ginger. And the first question is, there is a superstitious belief that there is an excessive consumption of ginger, garlic, and other spices are hot foods and it irritates the mucous membrane. Throw some light to this aspect. In a similar tone, we have another question that says, is the use of pre and probiotics after the use of ginger also, because more use of ginger could irritate the mucosal layer of the stomach? So the two related questions, if you will be able to take them.
So with respect to the effects of the generation of heat, the vata, the dosha and stuff like that, again, this is a highly Ayurvedic phenomenon in which I don't really have a lot of expertise in. So I don't think I would be it would be appropriate for me to comment on whether these would increase your body heat and stuff like that. However, what I can comment on from a scientific perspective is that the evidence, the American Library of Clinical Evidence for ginger and its effectiveness against a lot of these viral infections has shown pretty weak evidence. So high intakes of some of these factors have not really been shown to be effective against respiratory health. However, there has been studies shown in animal and cell culture studies. I don't have really comments on whether it increases heat in the body or whether it after you consume it can irritate your gastrointestinal mucosa, and whether consumption of probiotics might help with it. Unfortunately, I don't see any research evidence or scientific evidence for that.
There's a question on vitamin C. Ma'am, what should we do if anyone has allergy to vitamin C? I presume they are asking allergy reactions to citrus, if that is what they imply.
There are so many other good sources of vitamin C. So citrus fruits, of course, are a good source of vitamin C, but you can increase your vitamin C content in the foods by sprouting. Sprouting increases vitamin C content. You can get that from fruits like mango. Mango has a good amount of vitamin C in it. So you don't necessarily have to rely only on vitamin C from citrus fruits. There are other good sources of vitamin C from other foods as well. And remember, your RDA for vitamin C, even if it's 200 milligrams, which is recommended right now for COVID, you can easily get that. You don't have to only get it from these citrus fruits. Red pepper, bell peppers, green capsicum, all of these are also good sources of vitamin C.
Does long-term intermittent fasting boost the immune system?
There is a lot.
How?
Yeah, so there is a lot of research studies that suggest an interplay between intermittent fasting and immune health, largely because intermittent fasting can reset your body's metabolism. It can improve inflammation. It reduces inflammation, intermittent fasting overall. And because it reduces inflammation, it can promote the activity of some of these hormones and factors which can fight your infections better. So there's a lot of hypothetical belief about intermittent fasting and immune outcomes. We don't really have research studies to support this.
There's another question about the cytokine storm. Any specific nutrient or dietary practice that suppresses the oxidative stress and an overreactive immune system, or the cause of cytokine storm?
In COVID-19, we don't know, but the citrus alice trial, it showed that high dose of vitamin C may be helpful, IV. So we're talking about IV vitamin C, which was shown that IV can possibly suppress the cytokine storm in this trial.
There's another question about this vitamin D. How do you think we can get adequate vitamin D during the quarantine?
Yeah. So that was a question that I knew was coming up. So that's the reason I didn't spend a lot of time in the lecture. So vitamin D, unfortunately, the food sources of vitamin D are very, very poor. Unless you've taken a lot of fatty fish, salmon, mackerel, cod liver oil, some mushroom, these are all some decent sources of vitamin D. Vitamin D is fortified in milk. You fortify vitamin D in some dairy products. So these are the only sources of vitamin D, and it's not a very wide source of vitamin D in your food products. So you have to either rely on sun, or you have to rely on supplements to get your vitamin D. And your vitamin D requirement, I don't know what the RDA for Indians is. For the Americans, it's about 400 to 600 international units. And I believe in India, it's 400 international units. So it is difficult to get your vitamin D solely from diet unless and until you consume, fatty fish, cod liver oil, and milk and dairy on a daily basis. During quarantine, if you don't go out enough, you have to try and get a vitamin D supplement. And vitamin D supplement D3 is possibly better. Because there are, of course, concerns with developing skin cancer and stuff like that with excessive sun exposure as well. So because of all of these reasons put together, I believe that vitamin D3 supplement would be the best way to go if you believe you don't get a lot of vitamin D from these food sources.
Another question is, are there any foods that can curb craving during the quarantine?
Foods that can curb craving, again, it's a multidisciplinary approach. Craving is a combination of mental stress, lack of sleep, poor diet. All of these can contribute to, so a poor gut health can also contribute to craving. So it's just a multifactorial etiology when it comes to food cravings. So you possibly have these really bad gut bacteria in your stomach, which is craving sugar, right? So just alteration of your gut bacteria might be one of the best ways to stop sugar craving. So a mindful approach, just getting back to the basics actually, a mindful approach to eating, ensuring that you eat your meals holistically. So make sure you have time that's spent towards your breakfast, lunch, your dinner, eating holistic meals during those times, ensuring that you have foods from different food groups, food from different taste varieties. So ensure that all the different tastes are incorporated in your meal. All of these will ensure that you reduce your food craving. So food craving typically happens also because of micronutrient deficiencies. So ensure that your micronutrient status is adequate. So in this period, I would say eating a fruit with every meal might be one of the effective ways to ensure that your taste buds are satiated, ensure that your micronutrient deficiencies are taken care of. So, eating a fruit with breakfast, eating a fruit with lunch, with dinner, all of these are good ways by which you can ensure both a good micronutrient status and also ensuring that your receptors are all satiated.
Another question on vitamin D. What's the mechanism that reduces the replication when vitamin D is supplemented?
So one of the slides where I showed you, there are two antiviral factors. These are called catalysidins and defensins. So these two are factors which promote the inflammatory process, and vitamin D is thought to decrease these antiviral components and decrease the replication of the virus. Vitamin D is also thought to decrease the inflammatory cytokines and also improve the anti-inflammatory cytokine. So all of these together can decrease the viral load.
Now, the next question is about the absorption. How do you think we can increase the absorption of vitamins and minerals in our body?
This is a good question. Absorption of vitamins and minerals in the body, again, it's a big topic, as all academicians know. You want to make sure that the competing micronutrients are not taken in. So when I say competing micronutrients, if you're just having your breakfast with a fruit and then you take in coffee, you're going to impair the absorption of several micronutrients. You're going to impair the absorption of iron. You're going to impair the absorption of some of these trace nutrients with excessive intake of caffeine. So the first step would be to make sure that you reduce the intakes of these competing factors like phytates, reduce the intake of caffeine with foods, reduce the intake of tannins with foods. All of these will ensure that your micronutrient absorption from foods is adequate. When you're taking in a supplement, every supplement has different regimens. For example, if you're taking vitamin D, the best way to take vitamin D would be with a meal because you need fat for absorption. When you take calcium, for example, you want to ensure you don't take more than 250 to 500 milligrams of calcium at any one time because anything over 500 milligrams doesn't get absorbed. So it's different for every nutrient. But overall, I think if I have to pin down three key factors, it would be avoid taking it with caffeine and tannins and other nutrients. Ensure that you get most of your micronutrients from natural sources because those are definitely a much better way for your body to assimilate these micronutrients. And finally, if you're taking supplements, ensure that you follow the regimen of taking it with a fat or with meal or otherwise. So those would be the three key ways.
With regard to vitamin D, there's another question asking, how much time of exposure to sunlight is required for actually absorbing vitamin D every day?
So the recommendation is 20 to 30 minutes of hands and face exposed. That's the recommendation for you to get enough vitamin D. So your hands have to be exposed, your face has to be exposed. When I say face has to be exposed, no moisturizer as well. An SPF of 8 is enough to block vitamin D production. Now, if I say this, the dermatologists are going to fight with me because they're going to say that it's going to increase your risk for skin cancer if you don't have enough, sunscreen on the face, or if you're just going to go out with bare skin. And this is especially a concern in the Caucasian population because they are at a higher risk for skin cancer. The Indian population, we naturally have more melanin. So because we naturally have more melanin, the risk of skin cancer is less of a concern. So there was just one study that came out recently where they compared how much vitamin D people can get from sun versus supplements. And they found that getting it from supplements was much better than getting it from sun to improve deficiency. So if you're vitamin D deficient, don't rely on the sun to increase your vitamin D levels. If you're vitamin D adequate, just 20 to 30 minutes of exposure every day will ensure that your vitamin D level is maintained. But if you're deficient, just exposing yourself to sun will not help you.
There's another question with regard to what is can you explain about the synergism between nutrients and better immunity?
Okay, so I thought that was the focus of the presentation, but
Entire thing, yeah.
yeah.
Probably just a take-home message, like what kind of synergistic role a few of these nutrients give towards better immunity.
So I think it's one of the slides that I put up initially where I said there are 5 ways by which nutrients can influence immunity. It can increase your adaptive immunity, it can improve your innate immunity, it has an antioxidant effect, it can lower inflammation, it can meet your energy and protein demands during immunity. So all of these factors put together can influence nutrition and immunity outcomes.
With regard to vitamin D, they want to know what time is it right to get exposed to sunlight because of probably the UVA and the UVB concern.
Yeah, see, the morning sunlight provides you with several, I would say the photoactive compounds that we are not completely aware of, which is not necessarily vitamin D. So the morning sun is good for receiving a lot of these non-vitamin D photoactive products. But if you really need vitamin D, the timing would be between 9 and 4, where the sun is at its peak, and you're also at an increased risk for developing skin cancer. So again, as I said, if you're vitamin D deficient, the best way is for you to be supplemented. It's not for you to go and get exposed yourself to the sun.
The final question to you, Deepta. This is with regard to omega-3 rich foods. They say that the omega-3 rich foods can also boost immunity along with the other micronutrients, as they are also anti-inflammatory. What is your suggestion with regard to this?
Right. So I think we touched upon that briefly, where the recommendation right now is about 250 milligrams of the omega-3 fatty acids, EPA, DHA, which is pretty much your RDA. So at this point, don't supplement yourself, ensure that you meet your RDA. So that's the take-home message of this talk. The take-home message of this talk is don't rely yourself on supplements to prevent COVID-19. Eat a balanced diet, which will meet the requirements of these micronutrients. Eat a balanced diet, and the special focus would be on vitamin D because vitamin D does have some influence on COVID-19 outcomes, and ensure you correct yourself of vitamin D deficiency.
Thank you, Deepta, for your cogent replies. It was a pleasure listening to you.
Thank you, ma'am. Thanks for this opportunity. It was really lovely to talk to all of you. And I do want to thank Kalai ma'am as well during this juncture for arranging this talk. So thank you.
Thank you so much, Deepta. It was an excellent presentation followed by very explicit information on the do's and don'ts. In fact, what we wanted to hear, uh, we unfortunately did not hear. In other words,
Right.
there is some magical nutrient or there is some magical food that can protect us from this COVID 19. However, it brings us back to the basics: have good nourishment, have a good lifestyle if you want to protect yourself from any kind of disease or infection. And of course, now the focus is on vitamin C and vitamin D. So, more than eating during infection or tackling the disease, we have to pay more attention to preventing the disease and having a balanced diet and including all the micronutrients at all times. Thank you so much. Now, as we always end with gratitude, it is my pleasure and privilege to propose the vote of thanks on behalf of the Department of Home Science. At the outset, I wish to thank God Almighty, without whose blessings and benevolence we would not have been able to conduct this program so successfully. My profound gratitude to all those who have put in their effort in technology, because of which we are able to receive this knowledge and share expertise across the globe, sitting in the comfort of our homes. My most sincere thanks to Principal Dr. Varalakshmi Anandkumar for her constant support and encouragement. My most sincere thanks to our resource person, Dr. Deepta Sukumar, although I fumbled a bit at her while giving her profile. And she has proven herself by her excellent presentation. Thank you so much, Deepta, for accepting our request immediately. In the same breath, I wish to thank Dr. Kanchana for connecting me to Dr. Deepta. My heartfelt thanks to all the retired staff who have wished me and blessed me for the conduct of this program and who are watching this program. Thank you for your effort and time, all of you. My heartfelt and sincere thanks to Mr. Purushothaman, our technical help, for his patience, consideration, commitment, and involvement. And without him, this live relay would have been impossible. And my most sincere thanks to Dr. Prema, who introduced me to the technical support and who has always been a pillar of strength and encouragement for me. My respectful thanks to my family members, Mr. Jayesh, Ms. Abhirami, and Ms. Shivani, who have all contributed in several ways to fulfill the requirements of this webinar. My affectionate thanks to all the faculty in the Department of Home Science, particularly Dr. Reggie, for the interesting interactive session that she conducted. And I also thank Mrs. Nisha, Dr. Kasturi, Dr. Anantalakshmi, Dr. Prema, Dr. Vijaypriya, guest faculties, Mrs. Prasanna, Mrs. Muthalakshmi, Dr. Sasikala, Mrs. Esther, Mrs. Kaviarasi, Mrs. Rubini, and Mrs. Bhuvaneshwari. They've always been a great source of strength and support to me. Last but not the least, I thank all the participants who have given us this opportunity to make this webinar. Thank you very much. I hope you can see the link to log in and submit your feedback forms. We will keep the link for quite some time so that you have sufficient time to log in and submit your feedback forms. Camera.